Question number 3.
My question is to the Minister of Health. Does he stand by all his statements regarding health services?
Mr. Speaker, yes, including the statement that despite doubling the health budget, the previous government got less for it.
The Honourable Ruth Dyson.
So does he still support Southland and Otago Health Boards cutting home support services? And if so, what does he say to Lisa Gray, who said in her local paper, quote, "When my mum's home help is cut, her Meals on Wheels will end too. Receiving help is a prerequisite for eligibility for Meals on Wheels." She goes on to ask the Minister, can I coin a new word, geriatricide?
The Honourable Tony Ryall.
Well, what I would say to that lady, and I'm unaware of the particular circumstances that she's raised, is that it would be very important for her to be in touch with her district health board, because the chairs of the boards have been quite clear that no one will be unsafe or forced from their home as a result of these changes.
The Honourable Ruth Dyson.
What does he say to the Christchurch man who received a letter from his doctor on 17th of March saying, quote, "My request for you to have a knee x-ray has been declined because of financial restraints. We could try again later if things get a lot worse, or you could pay to go privately."
Honourable Tony
For
Ryall.
an x-ray.
Mr. Speaker, I'd say to that member, if she has a specific case that she'd like me to look into, I would very well be prepared to. What I can tell that member is that the Canterbury District Health Board last year received a substantial funding boost of $52 million.
Michael Woodhouse.
Thank you, Mr. Speaker. Supplementary to the Minister. What reports has he received on improving frontline health services and, in particular, childhood immunisation?
Honourable Tony Ryall.
Well, Mr. Speaker, I've received a report from the Ministry of Health on progress in getting more Kiwi kids immunised. And I'm pleased to be able to report that the national immunisation coverage for 2-year-old children has now reached 85%, the highest it has ever been. The June 2010 target figure met already. This is an amazing achievement when you consider that it was only 75% a few short years ago under the previous regime.
The Honourable Ruth Dyson.
What advice would you give to the 66-year-old South Dunedin man who received a letter on 26th of June last year telling him that he would get his eye surgery within 6 months, but who is still waiting for that surgery 9 months later?
The Honourable Tony Ryall.
Well, I would say that would be very concerning if the facts are as the member represents it. If she is prepared to give me the case, I'll have a look into it. What I can observe is there is far more elective surgery being provided for patients than there was under the previous government.
The Honourable Ruth Dyson.
What does he say to the people of Canterbury who have been told in an article headlined "Health Cuts Hitting the Front Line" that they have lost a Samoan community health worker, a Māori community health worker, contracts for chronic conditions care and child health care, all frontline services, all cut?
Honourable Tony Ryall.
Speaker, what I would say is to those people in Christchurch is that they know we've inherited a very difficult situation in their district health board area, that despite putting $52 million of extra money in there, there are problems. But I'd also say to those people, don't believe everything that is necessarily put to them by the member opposite. Because the member opposite yesterday said that a general practitioner had made a comment.
Point of order, the Honourable Darren.
Mr. Speaker, it can't possibly help the good order of the House for ministers in their reply to suggest that members of the public not believe certain statements that are made by members. This is a very clever minister. I'm sure he can craft an answer without abusing people.
The member's point of order was perfectly valid. He doesn't need to comment on the minister. He's just pursuing under a point of order the kind of thing he was saying shouldn't happen. And the member's quite right. I'd ask the minister to desist from referring in any derogatory way to the questioner. That's not really necessary to answer the question.
Speaker, members of Christchurch should not accept everything that the member opposite says because what she often represents to be the case doesn't prove to be the case under scrutiny. What I would say is that work is underway in Canterbury looking at their various contracts, and it's actually being led by GPs, nurses and PHOs. Order.
Point of order, the Honourable Ruth Dyson.
I seek to table 3 documents. The first is the letter to the 66-year-old South Dunedin man I referred to, telling him he'd get a surgery within 6 months, who is still waiting 9 months later. It has his name removed.
Leave is sought to table that document. Is there any objection? There is no objection.
Point of order.
The Honourable Ruth Dyson.
Second document I seek to table is the letter from a local GP in Christchurch saying that his knee x-ray has been declined because of financial constraints. They could try again if things got worse, could pay to go privately, and that again has been anonymised.
Confirm that the GP that she says is a GP is actually a GP?
Order.
Because yesterday she didn't say she got that wrong.
Order. Order. None. Order. I blame myself for allowing this to happen, but in the interest, point of order has been considered. In the interest of the House being better informed about what the document was, I didn't interrupt the Minister. Can I just come back to the Honourable Ruth Dyson seeking leave to table that letter? Can she give the House an assurance it is a letter from a GP?
Mr Speaker, actually you don't need to ask that because I said it was.
I accept that. Leave is sought. Now, order. The member, I accept, she had a perfectly fair point. Leave is sought to table that document. Is there any objection? There is no objection.
The third document, Mr Speaker,
Honourable Ruth Dyson.
The third document I seek leave to table is the letter to the Southland Times that I referred to in my first supplementary question from Lisa Gray in relation to her mother's home support cuts.
Order. Can I check, was that letter published in the Southland Times? No, we won't be seeking leave to table that. Question number 4, Aaron Gilmore.
Thank you, Mr Speaker.